as previously said, so I work at the Vaccinology Trials Unit at the Women's and Children's Hospital in Adelaide, and we're working on a randomised control trial looking at whether SMSs or calendars improve the timeliness of immunisation. So firstly, I'll go into the problem. So it's a graph, but on the left-hand side is percentage, so 0 to 100%. On the bottom are the months. So if, at the moment, nationally, ACIR, we were considering on time as being within a month of the due date. So that vertical line is the 1 month late. So at 6 months, there's approximately 20% of children late. And as we go on, at 12 months, MMR increases to 25% late. At 18 months, MMRV looking around 32% late. And then at the 4-year mark, we're out to 42% late. Now, whilst a lot of those ended up getting caught up eventually, what means for some of the vaccines, they're potentially vulnerable for a period of time, especially when they're quite young. So we were going to look at whether SMSs and calendars actually improve that sort of period of time. So a lot of primary healthcare, we do a lot of recalls, but we were looking at reminders. So instead of actually contacting them after they had been late, actually contact them before they were due to see actually if that makes a difference. So the interventions we were looking at were, as I've said, it's an A4 calendar and or SMS message that was sent 2 weeks and 2 days before each time point. So the time points we were looking at were 6 weeks, 4 months, 6 months, 12 months, 18 months and 4 years. So it was a randomised control trial. So one group was SMS only, the other was calendar only. Third group was the SMS and the calendar, so they had them both together. And the fourth group was no intervention. So the no intervention group was actually standard care because we couldn't give them nothing. So in South Australia, for example, they write the dates in the blue book or other interventions. So we recruited participants between February and December 2015, but we are following them through to the 18-month time point. So we're still actually just at the interim analysis stage at this stage. The iPad application was developed by us, went in combination with Securus, and it was designed for the immunisation providers. So there's a fair few apps around at the moment which are actually designed for the parents, which then involves the parent actually putting in the information and doing it, whereas this was designed for the clinicians. We conducted the trial in South Australia and New South Wales, and I've already told you our aim. And for the study, we're recruiting children under 16 months of age. So this is just a screenshot of the iPad app. So each clinic had a login and a password, and the way the trial was set up, they can only see their own clients, they can't see everyone else's. After they explained the study to the participant, they'd have to consent. So we had electronic consent, so they'd sign, put their names in, and continue. So the first screen, it's pretty straightforward and basic. Have to enter the child's name and their date of birth, and their name and phone number. And that's pretty well it. And from there, they continue, and the dates of immunisation are all automated, so they'll come out from the child's birthday at 6 weeks, 4 months, 6 months, etc. And that works fine when the child's on time, but obviously there's a few children who are late for the time that you see them, so you can actually click on the dates and adjust the dates. For the trial, at this point, you click continue, and then you'd be randomised into one of those 4 groups. So the calendar is just a bit bigger here, so you can see that the dates are actually highlighted in the calendar. It's A4, double-sided, designed to be stuck on a fridge or somewhere, and with the dates there. And the message was basically saying what immunisation the child was due, when they're due, telling them not to come in too early. And for the GB clinics, there was a number that they could ring. For the councils, often there was a website that they could go on and look at when the council was open. So the participating sites in New South Wales, the majority were general practice sites. We only had one in South Australia. There was 8 councils, 3 Aboriginal Medical Services and 1 community health centre. So this analysis is looking at data collected from ACIR on October 2016. We'll be doing another analysis sort of end of June, and that should capture all the time points. So we recruited 1,664. There was 70 we ended up excluding, so that leaves about 400 in each of the groups. And these graphs here on the left are the number of recruits, and the bottom is just the months that we enrolled. The little double blue one is basically just showing that we recruited reasonably equally in South Australia and New South Wales, and the larger graph showing that the councils ended up recruiting most of our participants for various regions, which I'll go into a bit later. So for this study, ideally it would have been great to recruit children at birth in hospitals and get them for the whole schedule, but we basically had to recruit them at their immunisation visits. So as you can see, that's bottom is their age in days, on the left is the number of subjects. So they're recruited at around the time points of immunisation, so 6 weeks, 4 months, 6 months and 12 months, with the majority at 6 weeks. The median age of recruits is around 4 months, which means for the earlier time points we don't have all the participants for the analysis. And at enrolment, 88% were up to date, and there was 12% not up to date. So I'll just, a few numbers here, but I'll try and simplify it. So the bottom group is the control group, so these had no interventions, and this is at the 6-month time point. So we've got 85% who are on time, so the original data showed we expected around 20%, so it's slightly better than we thought, which could be due to just the trial itself, even though the control group being in a trial can have that sort of effect. And whilst there was a 5% improvement in the SMS group, it's not enough of an effect size to say that that's due to our intervention. At the 12-month mark, the control group's down to 74% on time, and we can see now about 8% improvement for the SMS group, and about 10% improvement for the both calendar and SMS group. So now the size is big enough to say that there probably is a true effect from our interventions. And you see the calendar basically was no better than the control group. So in the end, as an intervention at 12 months, basically we'd need to enrol or do the intervention for 12 people for SMS to stop one child being late, or 10 for both the calendar and SMS. At 18 months, and at this stage we've only got about half of our participants at this time point. So we're down to 69% for the control group being on time. That's 30 days after they're due. And the SMS and the calendar, whilst there are small improvements, they're now back down reasonably close to the no intervention group, and the effect isn't large enough to say that that's working. And the calendar group is even worse than the no intervention group. So there's potentially some reasons for that, but we've still got half the children to analyse, so we'll have a look at that later in June. And as you would all be aware, implementation of new technology is often difficult, and this is especially so in primary healthcare, which is becoming increasingly complex and busy. So we conducted face-to-face telephone interviews with 24 providers. And overwhelmingly they were happy with the app. They thought it was well designed and easy to use. The major barriers were, especially for the GP clinics, was double data entry, so they'd have the iPad, their medical software, and potentially even ACIR in some places. And it's not just the time of the double data entry, there was also time in the consenting of the participants, and also with the calendar, I didn't mention, but there is a photo of the child, so they have to do a photo and that sort of stuff. So additional time, and even though that's only sometimes 5-7 minutes, that's still, when you're really busy, did have an impact on the study. And the providers thought the best way for us to move forward with this would be linking it to medical software, and whilst that would be reasonably simple, that's as far as getting agreements with other software providers and stuff, that's the more complicated bit. So that's what Securus are looking into at the moment. The healthcare workers liked the calendar, but felt the SMS was going to be more effective. We also interviewed the parents. We stratified the parents into the randomised groups, and we looked at those that are on time, those that are late, and the Aboriginal Medical Services. A total of 54 in all. So regardless of whether the participants were on time or late, they all thought they didn't need a reminder. They thought that they were organised enough to be on time. So what that means is the late group didn't really understand that they were either late or thought that they were organised and that they possibly weren't. They liked the convenience of the SMS messages, and they thought it was useful in their busy lives. It was on the phone. They could, if there was a phone number on it, just touch it and ring the clinic. The calendar, they liked the look of the calendar, visual prompts. They thought it created a conversation with family, and the fact it was personalised with a photo of the child they liked. There was relatively few disadvantages identified by the participants for the SMS. There were some participants who thought the calendar was outdated. The size was A4, so I don't know what your fridge is like, but they found it hard to stick somewhere that they were going to notice. And there were stickers were there that they'd stick on as they go. They didn't like them either. So in summary, both SMS and both calendars and SMS showed clinically significant improvements at the 12-month mark. At this stage, they haven't been replicated at the 18-month mark. Both parents and healthcare workers thought SMSs to be more acceptable for use in this manner. And moving forward, the interconnectivity with other systems, including ACIR and medical software, seemed to be the most important way to make this a sustainable, ongoing app. So in conclusion, the app reminder was effective at the 12-month mark, a useful intervention for improving infant timeliness. This is particularly so in councils where they didn't have quite as much data entry to do as the medical centres. So I'd just like to acknowledge both the sites in South Australia and New South Wales that took part in the study, all the infants and parents who took part, and our study team, who's all named there, and Securus for sponsoring the trial and sponsoring me to come here to the conference. Thank you all.